Hello everyone! In this video, I am going to talk about Alendronate. Alendronate is well familiar with two brand names, Fosamax and Binosto. It is available as a normal tablet under the first brand and as an effervescent tablet under the second brand. It is one of the medications that belong to the chemical group of bisphosphonates. It is given to people with osteoporosis to restore bone loss. Osteoporosis is a condition of reduced bone mass. It is more common in women after menopause. Especially in women with estrogen deficiency, this bone loss is more pronounced. In such women, bone mineral density is reduced, which increases the risk of bone fractures. Therefore, one of the primary uses of alendronate is in women with a risk of osteoporosis. It can be used both for the treatment and for its prevention. In addition, alendronate can also be used in men with osteoporosis. This medication can also be given to people with glucocorticoid-induced bone loss. Glucocorticoids are widely used medications for their anti-inflammatory actions. However, systemic exposure to these steroids at higher doses can increase the risk of bone loss. Alendronate can be used to restore this bone loss in such people. Another clinical indication of alendronate is in Paget's disease. It is a rare bone remodeling disorder. Normally, bones are recycled as you grow. Old bones are removed, and new bones are formed. In people with Paget's disease, bones are removed more initially, and new bones are formed improperly. This causes bone pain and weak bones. Alendronate can be prescribed to you to treat all these conditions. However, before using this medication, you should know important precautions that should be noted. So here in this video, I will explore such key facts as how to take this medication, how it works to reduce bone loss, and what the side effects are. We will also explore important precautions that should be considered while taking alendronate. First, let's see how to use this medication. Alendronate is available as tablets in various strengths. Each tablet contains alendronic acid as its salt, alendronate sodium. It is available from a low strength of 5 mg to a higher strength of 70 mg. Among them, tablets of 35 mg and 70 mg strength are more popular. For people who have trouble swallowing, alendronate is also available as effervescent tablets and an oral solution. You may be given this medication in two ways. It may be given either once weekly or once daily. The dose of alendronate is different in these two formats. Obviously, the weekly dose is higher than the daily dose. However, the net amount of medication taken is the same whether you take it daily or weekly. For instance, you may be given a once-weekly dose of 35 mg of alendronate or 5 mg of alendronate once daily. Both formats deliver the same amount of medication. Due to its convenience, most doctors prescribe alendronate on a weekly basis. The right dose of alendronate depends on many factors, like the purpose of its use, the frequency of administration, and any existing risk factors. Generally, for the treatment of osteoporosis, you may be given a dose of 70 mg of alendronate sodium once a week. You may also be given 10 mg of alendronate on a daily basis for the same purpose. However, a weekly dosage is more preferred by most patients. For the prevention of osteoporosis, it can be given at a dose of 35 mg once a week. In people with glucocorticoid-induced osteoporosis, alendronate is given at a dose of 5 mg once daily. However, in postmenopausal women who are not taking estrogens, the dose is 10 mg given daily. Your doctor may prescribe alendronate for longer periods, and in a few cases, it may be extended up to 3 to 5 years. Similarly, for the treatment of Paget's disease, alendronate is given at 40 mg once daily. Treatment can be continued for up to 6 months to restore bone density. Unlike other medicines, alendronate needs a few important considerations before you take it. The first one is the time of intake. You should always take alendronate on an empty stomach in the morning. The absorption of this medication is highly influenced by the contents in your stomach. That's why you should take this medication for at least 30 minutes before consuming your first food, beverage, or even any other type of medicine. This ensures maximum absorption of alendronate into your body. Second, you should take alendronate tablets only with a full glass of plain water. This ensures proper delivery of the tablet into your stomach. Taking less water may cause a small deposition of this tablet in your esophagus, which can cause irritation. You should avoid taking alendronate with beverages, fruit juices, and even mineral water. All these components can reduce the absorption of alendronate into your body. If you are taking an effervescent tablet, it can be mixed with at least 4 ounces of water for complete dissolution. Afterwards, you can drink the solution. However, don't swallow or chew the tablet. This may cause damage to your mouth or esophagus. If you are using an oral solution of alendronate, then take it with at least 2 ounces of plain water. Third, you should wait for at least 30 minutes after taking alendronate and don't eat any sort of food or beverage within 30 minutes. Fourth, you should stay in an upright position for at least 30 minutes and don't lie down until you take your first meal of the day. This ensures no damage to your esophagus. If you are taking other medicines in the morning, do not combine them with alendronate. At least a 30-minute gap should be maintained with other medicines. The same applies to calcium supplements that are often given with alendronate. They need at least a 30-minute gap. If you miss a once-weekly dose, try to take it only in the morning whenever you remember. However, do not take it before bedtime or before getting up. Never combine 2 tablets on the same day. Now let's look at how alendronate works to reduce bone loss. Normally, bone remodeling is an essential process in our body as we grow. Old bones are broken to release calcium and minerals into the bloodstream. This process is called bone resorption, and it is carried out by osteoclast cells. New bones are formed by a few cells called osteoblasts. As your age progresses, the rate of bone loss increases. In postmenopausal women, bone resorption is high, resulting in a loss of bone mass. Alendronate can help increase your bone mass by reducing bone resorption. Alendronate selectively acts on osteoclast cells rather than osteoblast cells. Osteoclast cells are responsible for bone loss by promoting bone resorption and the release of minerals into the bloodstream. Alendronate is actively taken by osteoclast cells, where alendronate binds firmly to hydroxyapatite, a mineral in your bones. Due to the acidic environment in the osteoclast cells, alendronate is converted into alendronic acid. This inhibits osteoclast activity and even reduces the acidic environment. Due to these effects, the process of bone loss is inhibited. However, in order to show a significant enhancement of bone mass, alendronate should be administered continuously for longer periods. Now, let's discuss what the side effects of alendronate are. Alendronate can make you feel stomach pain and abdominal discomfort. As this drug can increase gastric acid reflux, you can have a few side effects, like heartburn, indigestion, nausea, and gas. You can also have dull muscle pain and joint pain. Difficulty swallowing and jaw pain may also be noted. Now let's focus on drug interactions. Alendronate can increase the reflux of gastric acids into the esophagus, which can have a variety of gastric side effects. So you should be careful while using other medicines that enhance these side effects. Most of the painkillers, including aspirin, can increase these gastric side effects when used along with alendronate. Therefore, be cautious if you are using such medicine with alendronate. When to avoid. Alendronate is not recommended for some people, so you should check a few things before its use. If you have low levels of calcium in your body, alendronate is not recommended for you. This medication reduces bone resorption. Therefore, it inhibits the release of calcium from bones, thereby reducing calcium levels in the blood. That's why it is not recommended if you have hypocalcemia. If you have any problems in the esophagus, such as difficulty swallowing, and are unable to sit for at least 30 minutes, then alendronate is not recommended. Now, let's focus on a few important precautions while taking alendronate. With long-term use of alendronate, calcium levels in your body may be reduced. With low levels of calcium, you may have a few symptoms, like muscle cramps, twitching, brittle nails, and numbness in the fingers. Your doctor may prescribe calcium supplements to counteract these effects. Alendronate can cause a reflux of gastric acids into the esophagus that can cause irritation and inflammation. You may have a few symptoms, like heartburn, difficulty swallowing, gastric irritation, and pain in the esophagus. If not properly taken, alendronate can also cause ulceration and perforations in the esophagus. To minimize these effects, you should take alendronate in the recommended way. First, you should take it with a full glass of plain water to prevent any deposition in the esophagus. Second, you should avoid consuming food or beverages for at least 30 minutes after taking alendronate. Third, you should stay in the upright position for at least 30 minutes. Alendronate can affect your jaw and teeth. If you observe any unusual jaw pain or loosening of teeth, you should talk with your doctor. The use of alendronate is not recommended during dental surgery. Alendronate can cause pain in your bones and joints. It can also increase the risk of bone fractures, especially at the thigh bone. If you have aching pain in your hips and thighs, report it to your doctor. Your doctor may check for such effects at regular intervals and suggest the right option for you. Finally, let's see the chemical form of this medication. Alendronate has a carbon chain linked to 2 phosphate groups. That's why it's called bisphosphonate. Here, one of the phosphonic acids exists as its sodium salt. Therefore, alendronate is a monosodium salt of bisphosphonic acid. Here, this alkyl chain contains 4 carbons with amine and hydroxyl groups at the ends. This chain is 4-amino-1-hydroxyl butylene. That's all about the pharmacology of alendronate. Thanks for watching this video. Please don't forget to subscribe and hit the like button. Stay tuned for another interesting video with a new topic. Until then, have a nice time, take care, and goodbye.